Shall I start, or is someone making an introduction?
Dr. Haytham will have the introduction.
Yeah. Okay.
I will go ahead and get started.
Okay. So, welcome you all, and good day to you wherever you are. It is our pleasure to have you for this second episode of our webinar series that addresses and discusses the navigating challenges in humanitarian action with a focus on the Eastern Mediterranean region. And our webinar today is come under the theme of crisis to solutions. I'm Dr. Haytham Bashir. I'm the team leader of the Public Health Emergency Management Center, FEMIC, here at MFNet. And it is my pleasure, my honor to have with me today 4 distinguished speakers who will enrich the discussion about this topic in our today's webinar. As you know, we had our first episode last month, and the initial webinar discussed in a more general and theoretic way the humanitarian work, the challenges that the humanitarian workers and agencies faced during conflicts and other types of emergencies. And we identified with our speakers at that time 3 limitations. One is access, second, resources, and third, the violation of the international humanitarian laws and regulations. So to follow up on that discussion, our webinar today will provide more practical and operational discussion, considering the wealth of experience and knowledge of our distinguished speakers today. So now I would like to introduce Professor Faris Al-Lami. He is a well-known epidemiologist in Iraq and around the region with many contributions, both for the international literature and public health practices, who will join me in moderating this session. So, Professor Faris, it is for you, please, to introduce our speakers. Thank you.
Thank you so much, Dr. Haytham, for the introduction. And allow me, before introducing our distinguished professors, I would like to say some words again at the beginning. So by addressing the challenges facing humanitarian work, we aim for more effective, efficient, and safe humanitarian work, ultimately minimizing suffering and ensuring aid reaches those most in need. So in the tragedies of Gaza and Sudan lie the story of struggle and adversity, and the seeds of resilience and hope as well. As we navigate the complexity of challenges these conflicted areas face, it becomes increasingly evident that their stories are not meant to be mere reflections of despair, but rather compelling calls to action. And in the face of difficulty and hardship, tangible solution emerges from the crucible and discussion and collaboration among stakeholders, NGOs, and the state entities. In fact, these discussions are crucial where ideas are forged and strategies are shared, creating a roadmap toward a more sustainable, compassionate, and effective response. Today, we stand at the crossroads of tragedy and opportunity. And it is through our collective commitment to dialogue and cooperation we can distill meaningful solutions from the depth of the hardship. So the objective of this webinar will be to reflect on the challenges discussed in the earlier webinar, mainly relating to the access in crisis, limited resources, and enforcement of a humanitarian international law. Second, to showcase first-hand insights from conflicted areas in the Eastern Mediterranean region, mainly Gaza and Sudan. And thirdly, to share best practices and lessons from past humanitarian responses in the Eastern Mediterranean region, facilitating a collective learning experience that inform future strategies for effective crisis navigation. Now, without any delay, allow me to introduce our first speaker for today, Dr. Omar Latouf. And Professor Omar is a professor of surgery, director of NAM Foundation trustees, and a lot really of positions. But I would like to highlight that he's in charge of rebuilding Gaza health sector initiative. Which will be probably the scope of his discussion today. Dr. Latouf received his master and PhD degree in anatomy from Emory University and his MD also from Emory University School of Medicine. And before returning to Emory, he held a Mount Sinai Morningside Hospital position. His primary clinical focus on total coronary arterial revascularization and repair of valvular heart disease. Dr. Omar will reflect on the first Rebuilding Gaza Health Sector Initiatives Conference organized this month in Amman and share his recommendation on how to support Gaza and its victimized people. Dr. Omar, you have 15 minutes to present, and then we will go later on after completing all the presentation into the questions and answers. So the floor is yours. Go ahead, Dr.
Professor Lamy, thank you very much for your very kind introduction. And thank you for the thoughts that you have shared. I will always remember what you have said, from challenges to opportunities. I think that is a line well worth it for us to remember and make it a byline for activities that we collectively should address. Certainly from challenges, opportunities are born, and the burden is on us to transform those challenges into realities, opportunities, ways to help our colleagues and our patients. I want to express also my gratitude to Dr. Haytham Bashir for his kind introduction and for inviting me. For my co-speakers, Dr. Haytham, Dr. Bashir Kamaluddin, and I want to thank Ms. Dana Shalaby and the team at Eastern Mediterranean Public Health Network for the work that they do, the very important work that they do. Let me see if I can share my slides now. Are you able to see my first slide now?
Yes, go, please.
Great. The first international conference on rebuilding the health sector in Gaza was held in Amman on February 7th and 8th, where the catastrophic and unfolding crisis in Gaza prompted hundreds of concerned healthcare providers, public health officials, leaders of international organizations, representatives from the UNICEF, UNDP, World Bank, World Health Organization, Physicians Without Borders, ministers of health from 5 countries, presidents of universities, and governmental officials to convene. At such time, the participants investigated ways and means to address this burgeoning humanitarian and healthcare crisis and the needs of the citizens, particularly the infants, children, women, and the elderly. Speakers from Gaza and around the world, surgeons who were on site, and those who had just returned from Gaza, shared painful stories of the massive infrastructure damage inflicted upon hospitals, clinics, universities, water supplies, food supplies, in addition to the heartbreaking numbers of innocent lives lost and people injured, particularly amongst children and women. The participants, well over 500 in attendance in person and over 200 virtual, coming from over 150 national and international organizations from over 30 countries came together. We were surprised that people came from as far as New Zealand, Australia, Malaysia, South Africa, throughout Europe, and throughout the Middle East. The level of participants substantially exceeded our best expectations. We had over 50 registered speakers. We had to open 3 more extra sessions and add another day to accommodate the number of speakers, all of whom made fantastic presentations. The participants, as stated here, concluded in a unified Amman Declaration, which is published on the Rebuilding Gaza Health.org website. The participants issued this Amman Declaration and issued their collective determination to aid and advocate for the immediate assistance to the people of Gaza and for the rebuilding of the Gaza health sector and its academic institutions at standards in line with those defined by the World Health Organization. We issued a report, and in that report, we specified that our objective is to rebuild a healthcare system in line with international standards and not in line with substandards. We addressed a 4-phase plan to help support, rebuild, and modernize the health sector in Gaza. And we put it into 4 phases. Each phase has its own particular steps. Immediate support with the provision of supplies and food, the provision of physicians and nurses to help, a transition period with field hospitals that need to be in place, reconstruction phase to rebuilding and develop models, and then sustainable phase where such is maintained. One question that kept recurring that will have to be addressed is what ensures us if we rebuild a new and modern healthcare system, hospitals, clinics, and universities, that in 3, 4 years, 5 years, that they would not be destroyed in another conflict. So that is a question that has to be addressed. In this conference, we had international participants, with participants from Washington, San Francisco, and from Amman with them, Dr. Jabir, representing the Palestine Ministry of Health, spoke about trauma and mental health. And she coined a new term that I had never really heard before. The PTSD, she said, the post-traumatic distress syndrome, she said, does not exist in Palestine because it is a continuous distress traumatic syndrome. Our colleagues in the United States also had not coined that term. So that's really an issue for us to remember and address as we continue to work these issues. We had a session that was paneled by 4 presidents of universities. One of them now is the Minister of Higher Education in Jordan, Dr. Azmi Mahafza. And we had the president of the American University of Beirut, the president of the University of Jordan, and the president of Al Yarmouk University, where the discussion was on how can they collectively help and recruit more academic help for the devastated Gaza universities, and in particular for the students who lost their seats at their universities and faculties and now need to be assisted financially as well as academically to seek a place. We addressed operational initiatives that need to be pursued, such as the establishment of databases for the Alliance and the team members, build a database for parents of children in need of care, a database for healthcare centers and healthcare providers who need assistance, and how can we help those? One of the challenges that the healthcare facilities in Gaza are facing and will face, and it will be exacerbated once a ceasefire is in place, in that many of the healthcare providers and physicians may elect to leave Gaza in pursuit of secure economic security and personal security. And unless we provide support for them, then that will be a very critical challenge. Furthermore, we have decided to retain a public relation campaign and firm to advocate the strategy that the participants have agreed to, and establish international legitimacy by partnering with offices of international respected organizations such as the WHO and the United Nations, and publish our findings in medical journals. Those initiatives are ongoing now. Furthermore, we have decided on initiatives, action plans that we can partake immediately. We have certainly called for an immediate ceasefire. We are calling for immediate delivery of medical supplies and food, call for protection of healthcare providers and their institutions, advocate for financial support and sponsorship of the many thousands of orphan children and widowed mothers, advocate for funding and placement of medical students, nursing students, pharmacy students, dental students, and other allied health students who have lost their seats at their destroyed universities, and provide immediate delivery of financial support and to acquire infant formula to newborn infants and for nutrition to their mothers. Furthermore, we have agreed to host another follow-up meeting or meetings to promote the objectives of the first international conference on rebuilding the healthcare system in Gaza. A small number of the participating organizations, their names and logos are listed here, and we have collectively agreed that we will continue by having online meetings and a follow-up conference. The next follow-up conference that we are working on right now is probably going to be under the joint hosting of the initiative and the American University of Beirut. The title of this conference shall be the International Conference on Protection of Hospitals and Universities During Conflict, as it relates to international law and the Gaza scenario. This conference is tentatively planned for June 18, 19 of this year. It certainly will be at one of the campuses of the American University of Beirut. Will it be in Beirut or Cyprus is yet to be decided upon. This would be an academic conference for holding philosophic and academic conversations between academic institutions, universities, medical societies, hospital associations, civil societies, NGOs, and international legal experts from the United Nations and other sources to discuss what are the international laws, what is the Geneva Convention, to explain to us and those involved. The question is, as we rebuild the healthcare system in Gaza, and as we rebuild the universities, what assures us that they are not going to be destroyed and that the healthcare providers are protected so that they can do their job without fear on their lives after what we have heard of the huge number of physicians, nurses, and professors who have lost their lives in this very sad conflict. So the Amman conference was the beginning for a lot of activities, and we actually have started that process. Thank you very much for giving me the opportunity to speak. I appreciate that, and I look forward to hear your presentations and participate further in the question and answer session. Thank you very much.
Thank you. Thank you so much, Dr. Amr, for the enlightening presentation. And in fact, your perspective and experience in the field are enlightening, helping us grab some of the humanitarian challenges in Gaza and the way forward. And I'm sure many of the colleagues will put their questions in the chat box or in the Q&A box if possible. Allow me to introduce our second speaker, Dr. Bashir Kamaluddin Hamid. Dr. Bashir, he is an assistant professor at Sudanese universities, and Dr. Bashir is the Health and the Nutrition Director at Save the Children Sudan Country Office. He has been working on the ground with his colleagues at Save the Children, so he will be sharing realistic experiences on the current emergency situation in Sudan, the challenges that face the working NGOs and how Save the Children can overcome these challenges. Dr. Bashir, also you have 15 minutes to present your slides, and after that, again, we will switch properly to the question and answer after completing the third presentation. Go ahead, please. Thank you.
Thank you, Mr. Farid. And hi, everyone. First, I would like to thank you and thank the Infinite team for the now screen. Okay. You know if you can see my. Okay. Can I go ahead? Is it okay?
Yes, please.
Yes, please go ahead.
Yes. Thank you. So I'm Bashir Kamaluddin, Health and Nutrition Director for Save the Children Sudan office. I would like to start on some reflection about the situation in Sudan, just like few bullet points. So now Sudan is considered the largest internal displacement crisis, globally hosting 9.5 million people internally displaced, which is almost 13% of all the IDPs globally. In Sudan, 37% of the total population are considered at high levels of acute food insecurity, classified as crisis or worse. And over 14 million children considered need humanitarian assistance and support. In 2024, humanitarian support estimates needed to reach 14 million people is about 2.7 billion USD that need to be provided to support the Sudanese people in need. Moreover, about 65% of the population in country currently lack access to health care, and 70 to 80% of hospitals and health facilities in the conflict-affected areas are no longer functioning. In addition to this, currently the country is suffering different outbreaks like viral hemorrhagic fever and measles, and now the country reaching almost 10,700 cases of cholera reported since last August. All these needs are really, as an NGO or humanitarian actor, we would like to support Sudan as a country, but a lot of challenges are facing all the humanitarian actors on the ground. Delivering the humanitarian assistance in an ongoing war and a conflict have a huge security and logistical challenge. And international humanitarian response has been unable to keep the pace with the scope and to scale up their operation in Sudan to reach the people in need. I will navigate through some of these challenges, starting from the security and access challenge. Actually, there is indiscriminate use of heavy weapons and increased criminal acts are the major threat to all humanitarian actors in Sudan. To be able to reach these areas is a very huge country. To reach hard to reach areas, difficulties are ongoing because of the insecurity and the lack of commitment of both parties of the war to provide a safe passage for humanitarian intervention and humanitarian supplies. All the aid convoys face threats, roadblocks, and restrictions, a lot of bureaucratic procedures and permission needed, and this leading to stock out of essential supplies from most of the facilities in the country. At the same time, now it's not just two parties the Sudanese army forces or the rapid support force, but also other armed groups that we need to negotiate with all these actors on the ground to be able to push supplies to certain areas. I would like to set just few examples from the first months of the war, like one of the incidents, looting of 17,000 tons of food provided by the World Food Program to Darfur area. Within 1 month, there was reported 460 incidents and violence against the healthcare, either the healthcare workers or the healthcare facilities, and specifically the health personnel were targeted, and 82 health workers were killed and 42 were kidnapped. In addition to destruction of warehouses and looting of NGOs and UN agencies' vehicles in different states in the country. Apart from the security and access challenge, another challenge is the nature of the programs and multiple reprogramming. Actually, as an IS, we have different types of projects that we implement. Part of them are relief projects and we call it humanitarian interdependently, in addition to the developmental projects that have more sustainable effect on the country. Currently in Sudan, most of the funds are shifted toward the urgent intervention, and there's a suspension of developmental activities. Although this looks more life-saving, as I mentioned, it is not a sustainable approach. All the actors are currently reprogramming their projects, reestablishing their reforming and reorganizing new office from different locations. And as the war is expanding, there is no borders for this war. No one which state is going to be affected or attacked next time. So almost all of the actors are moving from one state because it is affected to the next state, which might be affected at another time. And unfortunately, we are repeating activities that we have already accomplished before within the same project and within the same budget. Then one of the most challenging part is the staffing.
Excuse me, Dr. Bashir, excuse me. Are you still on the same slide or you are moving slides?
No,
Can you reshare your slides, please? Dr. Kamal? Can you hear me, Dr. Kamal?
yes, I'm moving the slides if it is not moving.
Can you reshare your slides, please? Because we lost them.
Right. I think you need to drop the video first. So.
We appreciate the patience and commitment of our colleagues Save the Children despite the this connectivity in Sudan now for almost 3 weeks. The country is almost completely blacked out.
Can we share from our side, Dr. Kamal, if you like? Do we have backup?
Yes, please.
Dana, if you can share it from our side. Yeah, please go ahead. Yeah. Dr. Kamal, just mention which slides you are in. You can just say next and they will go ahead. Dr. Bashir, are you still there?
Slide, please.
Next, please. Next.
I already lost
next,
3
please.
slides more. Yes. Then for staffing, another next. Next, please. Next.
Yeah.
Yes. Yeah. I was here. The reflection was about the staffing. Actually, it was one of the challenging situation in Sudan for the humanitarian actors. Most of the NGO or UN agencies or local NGOs staff are actually Sudanese, and most of them are affected by the war or their families, and they need to be relocated themselves from one state to another. And this evacuation and relocation process is getting more insecure and more dangerous. In addition to the absence of health service, as already mentioned, and medical insurance company, and all this staff who are still trying to deliver the humanitarian support for the country, they are suffering either physical or emotional or psychological related stress issues. And whenever we are trying to bring in more international staff, still the permissions and getting visa is usually taking 6 to 12 months, and it will be very short for only 2 months, and then we need to repeat the process itself again. So staffing is also another challenge for the humanitarian work in Sudan. Next, please. And more recently, as you can notice, the issue of the communication and the internet in Sudan, almost more than 60 or 70% of the state have no network coverage, and those who have network, it is very poor and on and off service, and this actually affecting the follow-up, the interaction, and the communication within the agencies and within and in between different organizations. Next, please. Then we'll as another challenge in the financing. As by UN OSHA, the estimation of the needs for Sudan in 2024 is about 2.6 billion USD, and up to now it is only 31% is funded, and the gap is almost about 69% funding gap to alleviate the stress in Sudan and to reach those who in need. Also, the donors need to be more flexible and understanding the situation in Sudan is currently making um, making it very difficult to adhere to the same procedure that all the NGOs or other organizations were doing before. The inflation rates in the country are going very uh, drastically up, and this affecting the project implementation. The availability of markets and the good quality items in country is also going down, and most seriously the banking system, in addition to the internet connectivity, and having both gap in both the internet and banking system is almost paralyzing a lot of intervention and a lot of projects. Next. In spite of these challenges, I would say not just only Save the Children, but a lot of humanitarian actors are still in country. They are trying to provide. I will reflect only on Save the Children current footprint. Next, please. So, in spite of all these challenges, the map shows Save the Children presence in almost, I can say, 80% of the states in country. We are running like 52 million USD profile for humanitarian intervention in Sudan in different thematic areas, including health, nutrition, education, child protection, NFI, shelter, and food security interventions. Next, please. Um, we are active in the country. We manage 38 certified emergency response and 38 active projects currently across the country. But all these efforts and all these profile that we are running is
because at any time we might lose all these assets, we might lose the warehouses, we might lose the staff themselves. So I will conclude it is actually very difficult for humanitarian actors to intervene and to scale up their intervention to reach Sudanese people in need. Thank you.
Sorry, is this your last slide, Dr. Kamal?
Yes, thank you so much.
Thank you so much, Dr. Kamal, for this very insightful presentation indeed. And allow me to welcome the third speaker of today, Dr. Haytham Kousa. Dr. Haytham is the head of the health and care team at the International Federation of Red Cross and Red Crescent Societies in the MENA office. And we all know the role of the Federation really in emergency situation throughout the world, where they have a physical presence in more than 191 countries throughout the globe. And Dr. Haytham will shed the light on the public health challenges and the public health situation in the region and the role of the Federation experience and observe challenges. Dr. Haytham, you have also 15 minutes to present your slides, and then again we'll be open the discussion and the question that will be run by Dr. Haytham, inshallah. Go ahead, please.
Thank you. Thank you very much, Doctor. And I have no slides to present. I will speak from my notes, few points. First of all, I would like to thank you very much for inviting me for such privileged forum. When we talk about humanitarian, I don't want to focus a lot, to be honest, on specifying these humanitarian challenges we are facing. I will switch quickly into how we address this challenge, how we try to overcome this challenge. All of us, we know what we are facing on the ground, especially in recent emergencies we are facing in MENA region, starting from Sudan crisis or recent Gaza crisis now, and also other natural disaster emergencies as well, in floods in Libya or earthquake in Syria and Morocco. So when you talk about access, the humanitarian access is not only related to the security. Security could be the main reason to hinder the access during a humanitarian response, but also acceptability is one item that and element we need to think about when we think about humanitarian access. As a humanitarian agencies, as Dr. Lamy mentioned, in Federation, we are working with and coordinating the work of 191 national societies. Here is the key for success if you think about access during a humanitarian and crisis. It's the localization. When you talk about access, we need to think about local actors, local communities, local NGOs, civil community, who present there and continue working even during the harshest situation or context. So as organization working from outside, yes, we can help, we can support, we can deliver more aid, but at the end, it's in the hands of the people on the ground. What we see that our investment we do every day in the local national societies, Red Crescent or Red Cross national societies, is the reward we have during the emergency response. This was explicit during recent crises in Sudan and in Gaza also. When you look now to see the humanitarian corridors and who is managing this between Egypt and Gaza, it's the Egyptian Red Crescent and Palestinian Red Crescent on the other side. So this is how we think a lot about and invest our time and effort in building their capacities and resources. However, it's not an easy process to say it's to invest and build their capacity. We reach to the point that they themselves lost everything. They couldn't have anything. They are living in what we call protracted crisis, emergencies after emergencies, and not only protracted, but also complex emergencies. When we think about, we start with a crisis for 4-6 months. To be honest, we in Federation, in the Red Cross movement, we define the emergency in 4 months only. After that, we need to switch to recovery. In WHO and UN agencies, they define emergencies over 6 months. Then you switch. But when you look to reality, most of the crises now extended beyond this time frame. So we have protracted the crisis, which is complicated by other emergencies, other public health issues. We started with a conflict or unrest, civil unrest. You jumped into outbreaks and epidemics in certain contexts, ended up with malnutrition crisis as well. So how you manage and address these, it's also another elements we need to build what we call resilient health system in these countries. When you talk about resilient health system, yes, we talk about localization, capacity building, and invest in short-term plans and have these plans to be flexible and agile enough to absorb these shocks. So another element also we are facing here, it's a brain drainage. When you look to this situation, the crisis and the economic crisis as well, and social unrest, so we have and witnessing a brain drainage, which also make the capacity building another hassle. When you invest in some people for a couple of years and then they left, they travel, they are displaced, they are not available anymore, you need to keep this cycle going on and on. So it's not an easy, but it's something we need to keep and continue doing all the time. Invest in local capacity and think about pre-position of stocks. We always have these regional hubs in different big cities, in Dubai, in Copenhagen, but having some sources and materials available with those national societies on the ground, those are the key for a fast and a quick response and reach to the targeted population. So we need to think about repositioning some of materials and the stocks at country level, and not only at HQ also, but also at the branches. For example, in Palestine Red Crescent, we have 5 branches across Gaza Strip where they have all materials and ambulances and services available to dispatch whenever needed. Invest in preparedness. This is a key for effective response. Yes, we need to invest in response and humanitarian, when open humanitarian corridors to support affected population, but preparedness and building scenarios and drills and exercises to see how response should look like. It's another element of success to respond effectively during emergencies. When you talk about digitalization and going green, it's not luxurious, to be honest. Now option. Yes, we face outage and we face lack of fuel and everything, but having one solar panel available in a one house or office could help saving you energy over the daytime, having access to internet and doing some telemedicine that can save some people's life. It's not a luxurious or complementary things. It's something we need to invest in new technologies, in green energy, solar energy. This is something we really need to invest and to enhance our capacity in responding to different emergency scenarios. I will switch to talk about resources. When you talk about resources for a humanitarian crisis, unfortunately and sadly saying, we are witnessing diminishing of humanitarian aid in general, and sadly politicizing of humanitarian aid. Now humanitarian aid are funded and channeled by big donors, and it's politicized, completely politicized. We cannot deny this fact. The obvious example we witnessed as in the Red Cross movement was the Sudan crisis, and in comparison to Ukraine crisis. I can share honestly. For Sudan crisis, we managed to get zero fund for our operation because it's not on the media anymore. On Ukraine crisis, we reached to the point that we don't know what to do with the money. Can you imagine how this big difference? Because that's in the media, all donors are interested to help Ukraine crisis, but at the end you reach to the point, really, we did everything to the point we don't know what to do more. In comparison to the Sudan, we didn't have money to influx food only, food parcels, simple intervention, not talking about saving lives or human health or another. No, it's simple food parcels we don't have money for. So unfortunately, this is the reality. And what we try to how we try to overcome this also. We have built a fund, a pool of money that is available with federation only, with us, collected from big donors that we control to dispatch to national societies who are affected by different emergencies. Based on certain criteria and assessment, we can dispatch up to $500,000, $1 million USD to them to respond during emergency phase. So we try to expand this pool of fund, and this is what we try also to advocate for with other global forums, with other big donors, that we need a special fund available for emergencies, not controlled or managed by big donors, to avoid this politicizing and diminishing of a humanitarian fund that affect humanitarian aid in general. When you talk about a violation of the humanitarian law, to be honest, what we are witnessing now in Gaza, specifically in Gaza, it's unprecedented, to be honest. Usually, as a Red Cross, we have always granted access, especially during conflict time, and we have granted a hotline access to all conflict parties on the ground. Unfortunately, this line was completely shut down and closed since the beginning of the war. How to overcome this? To be honest, I have no solution. I have no answer for this. It was really difficult time to see that our ambulances, our humanitarian works are targeted on every day. Even after coordination, they've been targeted and killed. This is unfortunately and sadly to say this, and to be honest, if we couldn't have, yes, we do a lot on humanitarian diplomacy and advocacy level, and highlighting this and keep record on the attacks on healthcare facilities. But to be honest, if you didn't have a measures to hold those people who violate this humanitarian law accountable for their deeds, we will see this happening again and again. It's a big topic. No time to dig deep into these details and talk about different elements, but what we do in Red Cross, we keep investing more and more in humanitarian diplomacy and flagging that humanitarian workers, health workers are not a target. They are protected under different laws. Their work should be unhindered at any points in the conflict. So this is something we keep doing, advocacy in different platforms, highlighting and talking about these violations in every platform we can during our work. But to be honest, at the end, we try to keep balance, to keep access and to keep deliver what we can deliver. But this balance, to be honest, becoming more and more challenging with this huge number of violations we are witnessing on the ground. So it's difficult for any organization to keep silent and keep working, witnessing this happening on the ground. We'll do more and more on this file. I think after this conflict, many things will be changed, especially when you talk about humanitarian law and Geneva Conventions. We need to talk a lot about how to have effective measures to stop these violations and to protect the humanitarian worker and health worker during this crisis. This is in brief what I wanted to share with you. I hope I didn't exceed my 15 minutes. And thank you very much, and we'll be happy to answer any questions.
Thank you so much, Dr. Haytham. Really very insightful talk. And it's very realistic and from the field, and from the heart as well. And you convey a lot of lessons and a lot of recommendations, particularly in the area that I can see from legal point of view. Dr. Omar, probably in the coming webinar or the coming conference that we will have, and discuss a lot of, let us say, from academic point of view, what will be next, considering the current Geneva Conventions, for example, what we are going to do later on, considering this violation of the existing one. What shall we do? Shall we keep silent, or what will be? I'm sorry to say that, but now, thank you so much for the great presentation that the three speakers had, and I will handle to Dr. Haytham, the floor is yours now to handle the issue of the questions and answers, but it is beyond my control that I raise this point with Dr. Haytham. So thank you
May
so
I
much.
comment on Dr. Haytham's important point when you give me the chance?
Of course, of course.
Thank you.
So I'm actually now it is for you, Professor Omar, to comment on any of the speakers' reflections, but also you may consider a burning question that I received. So you may consider both or response to both. The question is about the conference that you organized in Amman this month. There are many recommendations, and so the question is how to translate those recommendations into actions on the ground. And many countries, many agencies, many health professionals are willing and so keen to support Gaza. How they can get the opportunity to support or to contribute to this support to Gaza. So floor is yours, Professor Omar, please.
Thank you, Dr. Bashir. Let me address the very important point that Dr. Haytham raised. The protection of institutions and healthcare providers so that they can do their humanitarian and medical work. The conflict in Gaza, the war in Gaza, and the number of fatalities and injured people, as we are confirmed by the Palestine Ministry of Health and confirmed by other organizations, the number of dead is exceeding 35,000, probably 40,000, and the number of injured is probably approaching 100,000. The conflict in Ukraine, the number of dead over 2 years is 35,000, a large number. But what has happened in Gaza in 4 months, between a very small group of people who have been besieged for the last 50 years and a superpower, has not happened since World War II. I do not know that there is a simple answer for the very relevant, crucial, and important question that Dr. Haytham rightfully raises. I don't know that there is. And for that reason, we have decided to host an academic, philosophical conference in partnership with President Fadl Khouri and the American University of Beirut to raise the question about international law for the protection of universities and healthcare institutions and providers, and use the Gaza scenario as an example. What's happening in Gaza today could happen to anyone else. Moving hospital ships could come under fire, irrespective of to who they belong. And if they are not protected by international law, then that is very serious. Wars could break anywhere. Unfortunately, catastrophe can happen anywhere. So we are aiming to have that philosophical conversation and to bring parties from all over the world to review, discuss, deliberate, and publish. I do not know that we can come up with an answer, but certainly we need to put this issue on the forefront, address it, and directly or indirectly put the pressure on those who are involved to abide by acceptable Geneva Conventions. Your point is well taken and must be addressed, Dr. Haytham. The second question that you have asked me, Dr. Bashir, on what actionable items. In my opening statement, at the Amman conference, I was very clear to the 500 plus audience in person. I said to them, I am not going to thank you for being here, and don't thank me for being here. Both of us are here for a duty that we must attend to. And every time I hear about the children of Gaza and the women of Gaza who are starving, I feel smaller every day. And I said to them, this conference is the beginning. If you're coming here to listen and talk, you are coming to the wrong place. We are going to start with an action plan. And actually, we are starting action plan. We have committees that we have established. We are hiring personnel who will work on these issues. We have upcoming meeting. We have an upcoming meeting actually this coming Sunday at 8 a.m. New York time with an update and debriefing of what we are going to do. We're implementing committees. We want to serve as a clearinghouse for all of those organizations that came forward, 200 plus organizations, so that we can interconnect parties and we can advocate and we can promote some of the questions that have come here. How can we help the students? We're going to promote their issue, and we have promoted their issues, and we're hearing from universities in Europe, in Turkey, in the Middle East, who are willing to accept those students. We need a voice, a unified voice that is non-political for the people of Gaza, that takes the issue of the starving newborns and infants. And we have made that an issue for us, and we are getting support from Europe already, and as well as from the Middle East, of donors who want to contribute formulas and milk. We've raised the issue of the healthcare providers who have been, first of all, in good times, they were earning 40% of the salary of those of their counterparts in the West Bank. Right now, they have been paid nothing for the last 4 months. So we're advocating the establishment of a bona fide fund to help and support physicians, nurses, dentists, pharmacists, and others who are working. So we are, putting a mechanism in place, and actually it starts to paying off. The larger issues require more time. We have a committee was planning to build an orthopedic hospital. We have asked them to expand that to become a multi-specialty hospital. That's the Fajr Scientific, and make it into a multi-specialty hospital. And we have our partners in Europe, Palmed and Jormed, where are about 1,500 physicians in those two groups, plus 300 in the United States, who can staff those physicians. Regarding the orphans, we are working with the Palestine Children Relief Committee, who have an orphan support program to advertise, market, promote through our entire network, as well as through houses of worship in the United States to raise funds to support orphans. Those are the things that our committee is doing, and we are getting support beyond our expectation from our expanded network. Thank you.
Thank you. Thank you so much, Professor Omar. And just to reassure you and colleagues that many agencies, including MFNet, also we are developing our plans, waiting for the access, to be frank, in order to provide also or to contribute to the ongoing efforts. And if I may move to Professor or Dr. Kamal, thank you for your reflections on the situation in Sudan, although I'm actually following up almost daily, but you really provided us with new angles that highlighted it. So my question, Dr. Bashir, is that we published an article here in MFNet, and we called Sudan the silent or the forgotten tragedy. So with such reflections from your esteemed organization, Save the Children, I'm sure other NGOs, and many other actually contributors on the ground, they have also much to share. So my question, how can all those NGOs or partners in the ground or in Sudan, South Sudan, work together in order to present the case of Sudan to the international community to shed more light on the ongoing tragedy. And we listened to Dr. Haytham Khosan that Sudan tragedy is not having that, I think, much focus. So my question, how we can work together as the national NGOs, as partners, in order to make our case or the Sudan case visible to the world? Yes, Dr. Kamal, please.
Thank you, Dr. Haytham. I think advocacy is what we need to advocate the people in Sudan.
Yes, Dr. Kamal. Okay, till we get Dr. Kamal back with us, and I said we appreciate his patience.
Yeah.
Yes, you are back.
So, sorry, yeah, and I think, yeah, I think advocacy is what we need to highlight the need in Sudan. Actually, Sudan was very unlucky to have this tragedy in between the Ukraine war and actually all the highlights are going to other countries while there is a huge need in Sudan. This is what we are trying to do, and you have already started through this webinar to reflect this and to allow us a space so we can reflect on the actual needs of Sudan, and this is what we need to continue and go on. Thank you.
Thank you so much. And since we still have more questions, I will come back to you with more questions. So now my question to Dr. Haytham. You mentioned the strategy that the Federation works in supporting the national communities because they are the frontliners on the ground. I would like to ask you about your experience and the Federation experience in building the capacity of the communities in such areas of conflicts. We know that many of official or even voluntary NGOs, they don't have the access. So is it possible, or are there examples from previous conflicts that the people themselves on the ground to be maybe trained for simple public health interventions like wash activities or cleaning water, etc.? So do you have such examples from previous events? And how effective do you think is this approach?
This is with no doubt, with no hesitation, I'm saying, Doctor, it's the most effective approach we can consider. And the examples of success are many. I will highlight a couple of them quickly. In Somalia, during the cholera outbreak in 2017, if I remember correctly, there was a big cholera outbreak in Somalia. And we sent a CTC, cholera treatment center, to Somalia with a capacity of 60 beds. Okay. After we finished the response and the epidemic was contained, we left this hospital, the CTC, with the Somali Red Crescent Society there, and they split this into 3 small units, 20 beds each, and they spread it between all common regions where these epidemics can come again. Every time they notice an outbreak or alert about increasing number of acute watery diarrhea, they jump in, check, and make sure they catch it up early, and they start these rehydration points at early points, health promotion messages, to the point that we stop seeing these seasonal outbreaks coming back and forth. In the same time, they asked us to invest in what we call community-based surveillance. It's a simple tool we have in Federation. we help people on community definition of these common diseases they have in their country. So, and we select 4 or 5 simple diseases that community volunteers can go door by door and check if anyone has these symptoms. So this could be also collected through simple messaging, SMS, and coding numbers by dash or stars or numbers. We know the disease and the symptom and the community they collected the information from. And then it gives us an alert about any increase or any unusual trend in certain symptoms. They managed through this tool to capture the first COVID-19 case in Somalia. Can you imagine how much this is effective? For simple tool, you just invest in building their capacity, they managed to collect and identify the first COVID-19 case in that country. So whatever we do in investment in the communities and at the national level stays there, and it grows up. Another example, for example, in Iraq, we helped Iraqi Red Crescent in building their capacity. You know, during the wartime and the conflict and unrest, there was some gaps in wash services and you know, the quality of water and access to water in Iraq, it's not an easy thing. So we help them in building their capacity in what we call reverse osmosis, RO systems, to filter the water and establish this capacity. We manage at the beginning to invest in this from outside. We bring them the tools and materials so they can start working and filtering water in certain capacities. They manage by themselves, by some of dedicated engineer in the society, to know how to build this system locally. Can you imagine? How to build and purchase all pieces of this system locally and produce these filters at local market with a fifth or maybe sixth of its price. We bring it from outside. So there's no doubt about investment in local communities and capacities. It would be the best solution for in emergencies and in long run as well.
Thank you. Thank you, Dr. Haitham. And I can see so many questions, but Professor Umar, you would like to respond to one of those questions from Dr. Abdul Latif Al-Husseini. But also I would like to share with you that we have colleagues and friends from Gaza. They joined us live for this webinar. So welcome our colleagues from Gaza. Yes, Professor?
Sure. I was writing a reply to Dr. Professor Al-Husseini. Our function is to serve as an interconnector between various organizations. It is very clear that there are so many organizations that are interested and working, each in their different pathway. But there hasn't been an interconnection between all of these dozens, hundreds of organizations. And what we're finding, if we pool everybody and let them know who is doing what, through that group, through networking, we can expand the power of delivery. Working together, intercollaboration is essential. Our voice will become substantially louder when we go to the United Nations, the United Nations Security Council, the United States, Europe, throughout our organization. Collectively, we are much more powerful. And as I stated, we addressed what people are calling low-hanging fruits, helping infants, orphans, widowed mothers, students, physicians, by promoting their cause. People are stepping forward and they want to donate and support those initiatives. The things that we are doing are relatively small, but when you have 250 organizations, each advocating through its network, the power will be huge. We need to take the cause of the people of Gaza viral. It has to become a global issue. People around the globe should be able to provide support, make donations, advocate. That's what we are trying to do. And I want to be realistic. We are, we're a young group, we're a young initiative, we're a young coalition. We're barely 3 months old, but the support we're getting is surprising us. And I think we are going to continue to forward. And we welcome anyone who wants to join this this coalition. Send us your information, send us your name. We'll put you with us, and we will share all of our information. What I will be very blunt. Don't ask me to do. Don't ask me to do. You come with me and let's do it together. I will say it, and I'm very frank. I do not want people to say, do this. No, come with me. Let's do it together. We can. Thank you very much.
Very wise and practical, Professor Omar. Many more questions actually for you, but just to make sure that I am fairly asking for the other speakers. Dr. Bashir Kamaluddin, being as an NGO in Sudan, and we all know about the communication challenges. For those who don't know, the country is out of communication completely. Phone calls, internet, and other means of communication for almost 3 weeks. So you as an NGO and maybe other NGOs in the countries, how could you manage this challenge of communication, either with your teams on the ground or maybe with other partners to coordinate your work, Dr. Kamal?
Thank you, Dr. Haytham. Actually, in the internet crisis was a very not for the organization in country. We were very dependent on internet in our communication with our country colleagues on the field offices and also with our headquarters. Still, for the NGOs, the collaboration is there. We are almost setting different hubs within different states. Sometimes some organizations have a separate networks like Starlink or direct satellite networks. Sometimes the UN agencies have separate internet connections, which is not dependent on the telecommunication networks in Sudan. We almost make like a schedule. So from 1 to 2, one of these organizations will come and work at this hub. And this is how we are trying to coordinate with each other. Yes.
Thank you. And back to Dr. Haytham. We have a question actually pending from last webinar, and today I received it twice. How you as a federation and other humanitarian workers can ensure the safety of the first responders, the precious public healthcare providers, from all those kind of threats that endanger their lives directly, not to mention their living conditions. So from your point of view and from the federation point of view, how we can protect those responders and workers on the ground?
Okay, Dr. Haytham, you can build this question for the following webinars, okay, to find a suitable answer. Because to be honest, it's difficult, and we trying our best. To be honest, now people even in Gaza, they are blaming Red Cross. They are not doing their job. They are not responding. How can I send a team if I don't have a security approval? How can I jeopardize their life and send them to respond to save someone if I'm not sure they will be safe? So it's all, as we keep saying, this security and safety is the responsibility of everyone, starting from the worker themselves up to the organization and politicians. If those people, parties, entities engaged in conflict and hostilities are not abiding by the international and law and international humanitarian law and Geneva Conventions and follow these strictly and held accountable for their breaches and violations, we will keep witnessing this more and more. This is the bottom line. It's their responsibility, but again, we have these laws, we have these beautiful conventions and laws available there, but in the same time, we see people violating this and selling us silly justifications and rational about targeting hospitals and targeting humanitarian law, humanitarian workers. And no one says any word about this. We keep shouting and screaming. This is not a target. Those should be protected. But if the big countries and the big whales, let's say, keep protecting those violators, we will not go anywhere. We will keep seeing these more and more. Full stop. Because to be honest, we need to pin this question and keep raising our voice in every forum about how effective this international humanitarian law. I heard a comment from a professor of international law at AUB, American University. He said, he was frank and said, we should stop teaching this topic for university students. After what we're seeing in Gaza, we should stop teaching this. It's not respected. It's not existed. If we don't abide with it, so what's the point? So it's a responsibility of all to keep talking, screaming, shouting, and raising our voice about the immunity of humanitarian and health workers during conflict time.
Thank you. And
respond to Dr. Haytham?
yes, please.
Dr. Haytham, I cannot agree more with you on how frustrating it is for major countries and organizations to advocate human rights for this group and that group and here and there. And then we see flagrant violations of basic food rights, water rights, infants' rights, children's rights. It is very frustrating. Having said that, we must not allow all the negativity deprives us and force us to give hope or reduce our determination. This is a horrible war that is taking place, and never expect your adversaries to step up to help you. It never happens. In the history of mankind, adversarial parties make it very difficult for their opponents in every way possible. And in every way possible, we must be resilient, and we have to be thoughtful, and we have to make more friends and new friends and encourage our friends to put pressure on their governments. We cannot give in. We must not give in. I share your frustration.
And for our esteemed speakers and audience, I think we also need to not to underestimate the power of social media nowadays, because if the law cannot be enforced, the social media and media in general, we have seen how effective they are in uncovering many of the incidents, and also the social media put pressure on the violators. And we have, I think, many examples. So altogether, we need also to consider all approaches through the law, through the force or other means. And I have more than 20 questions, actually. Obviously, we cannot cover all during this webinar, but as we used to do, we will try to respond to all those questions and share them in our webinar report or brief that usually be published within 2 weeks from now. With a promise of having a third episode of this series of webinar on conflict and humanitarian action in the region, inshallah, will be our next webinar. I would like to kindly ask Professor Faris to conclude the webinar and maybe a round of final message from our distinguished speakers. Professor Faris, floor is yours.
Yeah, thank you so much, Dr. Haytham. Thanks a lot to our distinguished speakers for their really great presentations, very realistic, very, I mean, there are a lot of tangible issues. It is not just like what many times we usually hear about just theoretical and imagination of how things are, but our colleagues here give some practical aspects of how to go forward in the midst of this humanitarian issues. I can grasp some of the points that Dr. Latov, for example, had mentioned. I'm really impressed by the statement made by one of the physicians in Gaza about the PTSD when that's removal the letter P. It's really shocking statement. And the other issues that I would like to highlight is I was really impressed by the huge number of organizations and people who give a hand for this forum, although despite the very short duration, something like 3 months, as I heard from Dr. Latov, and having such a huge number of physicians throughout the world who can give a hand once a ceasefire is there and a hospital can be installed and so on. I think this is something huge that collectively we can create a pressure group, a unified voice in order to make the major states, for example, to hear the voice of the people. And because, as Dr. Haytham mentioned, for example, if we go in this way, that's the international convention will be rolled out. So where the population will go on, where the humanity will go on after that, and it will be a great right for the AUB professor who said that we no more teaching for these convictions anymore if they are not functioning. So what is the value? But again, from the depth of the frustration, the opportunity can arise, inshallah. I would like also to highlight the statement made that to reinstate UNRWA, because nowadays we can see there is a lot of firing against UNRWA, despite that it is the main fuel probably for the life of millions of people in Gaza and outside Gaza as well. And thank you, Dr. Bashir Kamaluddin, for raising a lot of the challenges that NGOs are usually facing in the field. Some of them really can be dealt with, but many others probably they are difficult. But he re-emphasized the points that the last webinar had raised, which is the access to most the disadvantaged group and the law enforcement of a humanitarian laws. So these are, he emphasized really the great issues that had been raised from the last webinar. And Dr. Haytham really put great points. And the issue that he probably, again, apart from the huge issues that he described, but again, digitalization and the green energy, I think as he mentioned, it is not luxury. They can save lives, they can make things easier for different bodies, and even they can show and raise the voice of the people and make it reach to other parts of the world. For example, having energy for a while and you can make a video, for example, and share it through WhatsApp, this can make a lot of change. Without this small amount of energy that can be raised by a simple solar plant cannot be there. So I mean, these are, totally agree with you that these are not luxury. These are practical issues that we can build. And again, your great point about building local capacity inside the countries, I think this is something great that any country really should emphasize and work on. There are a lot of issues really I write in my notebook here, but I cannot, the time is not enough to capture all of them. But I think we have something like 5 minutes, and I will give the floor for each of our distinguished speakers for something like 2 minutes to make a final comment or statement. I will start with Professor Omar Lattouf.
Thank you, Professor Lamy. You have very eloquently summarized so many of the important points that all of the speakers has shared. Thank you very much for doing so. I would say stay tuned. We have upcoming conferences as we continue our advocacy through the partnership of the so many organizations. Upcoming meeting hosted by the American University of Beirut, a standing invitation by the University of Geneva, a standing invitation by the Knowledge Institute of Amsterdam, and an ongoing conversation with the Ministry of Foreign Affairs of Qatar to host funding conferences. So the work is starting and will continue. Thank you very much for this opportunity. Thank you.
Thank you, Professor. Dr. Bashir?
Thank you. I would say, firstly, thank you for our attendees, and thank you for you as an organizers and our co-speakers. As a humanitarian staff, we are going to provide as the best of what we can provide. Whatever the challenges are here, we'll provide service to those who in need. Just we need to speak up and speak loudly to highlight the gaps and the needs. So maybe at one time together we can overcome this. Thank you.
Thank you, Dr. Dr. Haytham, please.
Yes, thanks. Thank you very much for coordinating this and inviting me. And thanks for all participants and co-speakers. It was really enriching and fruitful discussion. Again, we appreciate all effort by all partners in the humanitarian field, and we keep repeating our message by investing more and more in localization in local communities for effective response during emergencies. This is the key for success if we need to reach the last mile and reach the most vulnerable people during any emergency situation. Thank you.
Thank you so much, Dr. Haytham, and thank you, Dr. Haytham Bashir, for being together really in moderating this webinar, and looking forward really for having another probably part 3 of this important topics that's navigating the challenges in humanitarian action. Probably we have the what will be next, considering from political point of view, from legal point of view, from academic point of view, what's next. Probably this is an area for further discussion later on. So thank you so much for the distinguished speaker for today's webinar. And thank you once again, Dr. Haytham, and thank you for Dana and her colleagues who are working behind the scene in facilitating this webinar, and looking forward to have another fruitful just like this webinar. Thank you so much, and have a good day. Bye-bye.
Thank you, Professor Fals. Thank you
so much,
Dr. Haytham, Dr. Kamal, and Professor
Thank you all.
Well, thank you, audience.
Thank you. Bye-bye.